This is Mackenzie German, and this is my blood pressure assessment video. The first thing you're going to want to do is have your client sit on a chair with a backrest and their feet flat on the floor and completely relaxed for 5 minutes before testing their blood pressure. It's important to be familiar with your equipment. You're going to want to make sure that the earplugs of the stethoscope are facing in towards your ear canal, as shown above, and you're also going to want to make sure that the little knob on the stethoscope is turned to the left and that the stethoscope is indeed on so you can hear the heartbeat. Here I'm going to walk through the basic procedures of an assessment of blood pressure. You want to make sure you have the cuff put on properly on the client. One side will say this side against limb as shown, and the other will say artery mark. You're going to want to make sure you match up that artery mark with the brachial artery, as you can see me doing right there. And unfortunately I needed the help due to a shoulder surgery, but my assistant came in and helped me make sure that that cuff was put on tightly, and you're going to want to make sure that at least 80% of the cuff is covered by the upper arm. I then place the blood pressure monitor on the cuff on the appropriate spot. After that, I measured approximately 2 fingers below the cuff, below the antecubital space, and over the brachial artery. This assured the best hearing possible with no noise interference from the cuff. Once I had the stethoscope placed accurately as previously found, I ensured that the client had their arm, right arm to right arm, completely relaxed at heart level. As my client's arm was completely relaxed and my stethoscope placed pressing firmly enough to ensure the most accurate blood pressure reading, I then began pumping the cuff up to approximately 200 millimeters of mercury, as shown right now. At approximately 200 millimeters of mercury, I then began to slowly release the pressure at a rate of approximately 5 millimeters of mercury per second. The first sound you listen to is known as the first Korsakoff sound, or phase 1. It represents systolic blood pressure. In my client, it came in at 118 millimeters of mercury. You then wait for the disappearance of sound, which is known as phase 5 of the Korsakoff and represents diastolic blood pressure. In my client, this came in at 64 millimeters of mercury. To ensure accuracy of the blood pressure assessment, it's important to take 2 readings at least 1 minute apart, with the average of the 2 readings being taken as the blood pressure of the client at hand. As shown in the figure on your screen, there are 5 blood pressure categories: normal, prehypertension, hypertension stage 1, hypertension stage 2, and hypertensive crisis. It is important to be able to categorize your client as to identify risk stratification prior to the onset of an exercise program. All in all, blood pressure is an essential way to ensure that the client is at no immediate risk and that the client also has appropriate cardiovascular response to graded exercise. It's a relatively simple procedure, but all steps and protocols must be followed verbatim to ensure accuracy and proper categorization of the client by the health fitness specialist.